Welcome to another day in Paradox. Today I'm going to delve deeper into something that I have previously covered, at least on the surface, but it's not so much a paradox in and of itself. It's more a paradox of metaphors, and that is what we call mental illness. And I find it problematic even as a practitioner in this field. And perhaps people will think I'm a radical. Who knows what kind of pushback that I might get if I were really trying to, create some sort of a system in which people practice the way that I practice, which I am not, as much as I want to be as open and as honest about not only what I have seen in the literature in my field, but also what I've seen in my day-to-day practice. And again, I understand that that is anecdotal to a great degree, but I've also already admitted and clarified that it's not my opinion that I practice hard science. Therefore, I'm not trying to achieve the same thing that the hard sciences are achieving. And there will be more on that in coming episodes, indeed. But mental illness, when we discuss it like that, we are building a metaphor. And that metaphor, because we can't understand what we can't see in the same way that we can what we do see. And so, for example, when I have a physical illness, I have symptoms. Those symptoms can be discovered, and they can certainly be treated in a variety of ways. Now, that doesn't mean that having an illness means that you're going to, treat them all the same. However, the way that we operate when we have an illness, particularly in treatment, is to the best of our ability, even in medical practice, understand what the illness is, provide some sort of a medication or acute therapy for it, and create an environment in which it can heal itself, right? Or your body can, using the therapy provided, heal itself. Well, let's just take the most common illness, right? The common cold. And of course, it's actually a variant of COVID virus. And we all know a lot about COVID now. Even something as severe as COVID-19, we understood that once we got it, a virus, we had some medicinal support that we could use for helping us cope with the symptoms, depending on what symptoms we were having. But rest and not overstressing ourselves and get back to normal life when we feel normal, right? And if we need to go to the hospital because the symptoms are worsening and have some additional kind of acute treatment, fair enough. But after that, we're going to feel normal. We're going to behave normal and everything else. And so the trajectory of illness is I have symptoms, I treat symptoms, I go back to life as normal when I feel normal. That's very problematic as a metaphor for our psychology. Because when we call it mental illness, especially sort of just as an umbrella term, not to say that there are not certain circumstances or certain diagnoses in the DSM-5, which is the current diagnostic manual, that would necessitate a similar kind of treatment. The problem is most of them don't. And most of the things that people come to therapy for, or they go seek psychiatric medicine management for, they visit a psychiatrist for a psychotropic intervention, most of those things are not well handled in the same way we would handle an illness. Take your meds, chill in bed, go back to normal when you feel normal. This is just not true of most of the things that we treat in human psychology. Depression, anxiety, those two things particularly, that's a terrible treatment for those things. It would be an awful treatment for those two things, which are the two most common things. And I mean, bipolar disorder is something that has both of those sets of symptoms as a part of it. And what we're talking about is if we call these things illness, we are building a problematic metaphor because we are programmed by our language to think of illness in that way. Hey, something's wrong with me. When I feel normal, then I can be normal. Terribly bad for our psychological interventions. This is why I prefer the metaphor mental injury. I won't get into statistics here, but I will, without any hesitation, say that I haven't yet seen a patient in 6 years of practicing therapy as both a student, a provisional therapist, and a fully licensed therapist. Not yet seen one patient that didn't have some level of emotional injury. Something that happened to them, some way in which they were abandoned or neglected, some way in which they were abused, some relationship stress, something broken. And broken is a much better metaphor compared to injury, right? If I break a bone, I tell patients this little story all the time. I've had several knee surgeries as a result of a car accident when I was 17, as a result of continuing to play basketball, even though I'm not really that good at it. And when I tore my lateral patella ligament, I had severe pain, knew there was a problem, a limited or inhibited function, knew I couldn't function, quote unquote, normally, knew I needed to see a professional that could help me achieve what I wanted to see as normal. That torn ligament needed a surgery, so it needed some specific acute care in the immediate short term to solve the problem to the best of the doctor's ability. In other words, to address the injury in a very specific sense. However, my orthopedic doctor told me, you won't ever be normal again. You won't be able to get, quote unquote, over this. That's the wrong preposition. You have to move with this. You don't move on from this. You move with it. And in moving with this experience, I went to physical therapy. And what did the physical therapist do? They pushed me until I hurt. It was painful. Many of the times I was in a physical therapist's office or in the gym in which they were sort of, torturing us, tears were in my eyes because of the pain. And the therapist was overseeing not only my healing, but also the fact that I was going to have to suffer regular bits of pain along the healing road in order to not only heal, but to achieve normal function after healing. This is why psychology should abandon the whole idea of mental illness and consider it mental injury. What injury needs to be treated or discussed? This is what EMDR therapy does more than anything else, or any other kind of specific therapy, is it seeks to find, where's the injury? The injury is present. The trauma is present. It's there. Where is it? Find it, acutely treat it, and begin the healing process. But the healing process only takes place when the acute injury is addressed, and then the continued participation of the person suffering in stretching and bending and pushing, even when it brings on emotional, painful experiences. But to the process of healing, it is adding the ability to function. And if we treat our psychological experience like illness, then we will be forever waiting to feel normal so that we can behave normally. If we treat it like injury, then we are activating ourselves and understanding that if I will address the injury and participate in the healing process, even when it causes me pain, but especially when it causes me pain, then I can not only heal, but I can achieve function again.